Hello, my fellow chipmunks. This is Chipmunk Speaks TM, aka Alura Gonzalez. I just want to start out by saying Happy International Women's Month, as March 8th is International Women's Day. Say thank you to all of the women who brought us this far in history. Special shout out to the Black Women Troop, the 6888, for their contribution in American history. If you have not already seen the movie, I guarantee it's a must-see. On to the video. Mental health is an essential component of overall well-being, yet it remains one of the most overlooked aspects of healthcare worldwide. This is particularly true when it comes to women's mental health. The unique challenges women face, shaped by biological, social, and cultural factors, often contribute to their increased vulnerability to mental health disorders. Unfortunately, these issues are frequently underrepresented or misunderstood. In this context, March's celebration of International Women's Month provides a timely opportunity to focus on women's mental health, raise awareness about gender-specific challenges, and advocate for policies that promote better mental health access and equity for women. Women's mental health differs from that of men, not just in prevalence, but in the specific disorders they are more likely to experience, the impact of their symptoms, and the way that they interact with social, cultural, and economic factors. Statistically, women are more likely than men to experience anxiety, depression, and eating disorders. According to the World Health Organization, globally, depression is the leading cause of disability among women, with a significantly higher prevalence in women than in men. Women are also more likely to be diagnosed with post-traumatic stress disorder, primarily due to gender-based violence, abuse, and trauma. Additionally, certain phases of life, such as pregnancy, childbirth, and menopause, present unique mental health challenges for women. Postpartum depression, for example, affects a significant percentage of women after childbirth and can often be dismissed as normal emotional changes. The hormonal fluctuations associated with menstrual cycles and menopause can also contribute to mental health struggles. However, the severity of these issues is often downplayed in medical literature, leading to women not receiving the help they need. While biological factors certainly play a role in women's mental health, social and cultural factors are often even more influential. The societal expectations placed on women can significantly affect their mental well-being. The pressure to balance work, family, and caregiving responsibilities, often referred to as the second shift, can lead to chronic stress, burnout, and mental health issues. Additionally, gender roles and stereotypes, such as the notion that women should always be nurturing, selfless, and accommodating, create an environment where women may feel guilt or shame when expressing vulnerability or needing help. The rising rates of gender-based violence, including domestic violence, sexual assault, and harassment, have devastating effects on women's mental health. Survivors of GBV, gender-based violence, are at a significantly higher risk for developing mental health conditions including depression, anxiety, PTSD, and substance abuse. Yet many women remain silent due to fear of judgment, retribution, or simply not having access to the resources they need to escape abusive relationships. Economic inequality and the gender wage gap also play a critical role in women's mental health. Financial insecurity can exacerbate stress, anxiety, and depression, and women, especially women of color, are disproportionately affected by lower wages and fewer economic opportunities. The lack of financial independence can create a barrier to accessing mental health resources and seeking treatment. International Women's Month, celebrated every March, is a time to highlight and honor the accomplishments, contributions, and challenges of women worldwide. It is a month to recognize women's rights, equality, and the ongoing fight for gender equity. One of the key goals of this month is to address critical issues facing women, including mental health, by raising awareness and starting conversations that may have otherwise been silenced. Historically, mental health has been stigmatized, particularly when it comes to women. In many societies, women are expected to be emotionally strong, supportive, and resilient, leading to the trivialization of their mental health struggles. International Women's Month provides an opportunity to challenge these stereotypes by emphasizing that mental health is just as important as physical health and that mental health issues should be addressed and discussed openly. In recent years, many advocacy groups and organizations have used International Women's Month as a platform to speak about the intersection of women's health and mental health. Campaigns focus on topics such as postpartum depression, eating disorders, the psychological effects of domestic violence, and the mental health challenges faced by women of color. These conversations are essential because they allow women to share their experiences, find solidarity, and demand better access to mental health care. A powerful example of this is the growing movement to recognize and address maternal mental health issues, particularly postpartum depression. In the United States, advocacy groups have worked to raise awareness about the importance of mental health screenings during the postpartum period. During March, these groups highlight the need for increased research funding and healthcare services to support women struggling with depression after childbirth. As a result, more women have begun to recognize the sign of postpartum depression and seek treatment earlier, and the stigma around these mental health challenges is gradually being reduced. Despite growing awareness, women still face significant barriers to accessing mental health care. These barriers include societal stigma, lack of resources, financial constraints, and cultural taboos. For many women, mental health services are seen as unnecessary or even shameful, especially when compounded by the pressure to fulfill traditional gender roles. Many women also experience difficulty accessing adequate mental health care due to economic limitations or geographic isolation, especially in low-income or rural areas. The cost of mental health care is a significant barrier, particularly for women who may not have the financial independence to seek professional help. In countries where health care is not universally accessible, the cost of therapy, medication, or other mental health services can be prohibitively expensive. Women from marginalized communities, especially women of color, low-income women, and LGBTQ+ women, often experience these barriers more acutely. In these groups, there are also fewer culturally competent healthcare providers, making it harder for women to feel understood or receive the support they need. Furthermore, research in the field of women's mental health has been historically limited. Much of the research surrounding mental health has been male-centric, focusing primarily on how mental illness manifests in men. As a result, women's mental health needs have often been overlooked or underestimated. The lack of gender-specific research means that many mental health treatments have not been tailored to meet the specific needs of women, further exacerbating disparities in care. The growing attention to women's mental health, particularly during International Women's Month, presents an opportunity to push for the systemic change. Governments, organizations, and healthcare providers must prioritize women's mental health by allocating resources for mental health services that are accessible, affordable, and gender sensitive. Policies must be implemented to reduce the stigma around the mental health issues and encourage women to seek help without fear of judgment. Moreover, we need more research into gender-specific causes, symptoms, and treatments of mental health conditions. By addressing the unique needs of women, we can ensure that healthcare systems are more inclusively and better equipped to meet their needs. Awareness campaigns during International Women's Month should not only inform but also advocate for long-term systemic change that reduces barriers to care. Additionally, women must be empowered to take charge of their mental health by promoting self-care practices, creating supportive networks, and destigmatizing mental health struggles. Education on mental health, available resources, and coping mechanisms is essential to fostering better mental health well-being for women. In conclusion, women's mental health remains a critical issue shaped by a complex web of biological, social, and cultural factors. International Women's Month provides an important platform to raise awareness about the unique mental health challenges faced by women, as well as to advocate for more inclusive and accessible mental health care. By addressing the barriers women face, reducing stigma, and advocating for better policies, we can create a more supportive environment for women to seek help and prioritize their mental well-being. As we move forward, it is essential that we continue these conversations beyond March, working together to create lasting change for women's mental health worldwide. Thank you for listening to this video. If you enjoyed this video, please like and subscribe and comment for more content. Once again, this is Chipmunk Speaks TM, aka Alari Gonzalez. I hope you have a good evening, good morning, and good afternoon.